This question reads, what is the most anterior portion of the heart? A, right ventricle, B, left ventricle, C, right atrium, or D, left atrium. So what we have to know here is our anatomy of the heart, okay? And this is very important also as it relates to EKGs and knowing where those forces are going towards, okay, with the lead placement. So let's go over our anatomy, okay? So here you can see our right atrium sitting up in this portion. So if we label this, this is the right atrium up here, okay? Then we have our right ventricle, okay, the RV sitting here. And then we have our left atrium, okay, the auricle of it. So left atrium's actually a little more posteriorly, okay? And then we have our left ventricle, which sits there, and that's this portion here. All right, so if you imagine this in 3 dimensions. So the question is asking, what is the most anterior portion of the heart? So anteriorly, okay, meaning towards us. So the answer here, as you can see from this depiction, is actually our right ventricle. This is the most anterior portion, and that's why when we have those leads, the anterior leads that are in the precordial leads sitting over the chest, we have V1 and V2, okay, giving us probably the best depiction. Obviously, we have our right-sided precordial leads that go to the right that will also help that, okay, towards this, giving us a good picture of this right ventricle. But all this portion here that you can see is our right ventricle sitting most anteriorly. In fact, the left ventricle here is more posteriorly, and same thing here with our left atrium. Okay, so the choice here that you should choose, the most anterior portion of the heart, is in fact the right ventricle. So choice A is the correct answer. Well, that's the end of this lecture. I hope you learned something.